Dung Polan. He has completed his PhD from Tripura University. Dr. Roy has published around 41 research papers, chapters, and articles. He is also the co-founder and CEO of Kinetic Graph Career Solution Private Limited and director of KND Think Tank Academy, LLP. He worked as a junior research fellow, which was funded by DST, a reputed one, from the year 10/09/2020 to 30 November 2021 at the Department of Geography and Disaster Management, Tripura University. He worked as a research assistant in ICSSR funded, which is also a reputed one, from 5th of September 2016 to 31st 07/2018 at the Department of Geography and Disaster Management, Tripura University. Dr. Roy worked as an area coordinator, World Bank funded from 01/08/2014 to 31st/08/2016 at the Rashtriya Gramin Vikash Nidhi. He has also presented papers in seminar, conferences, workshops at the various international and national level. In India, he has presented 38 papers and abroad one. Dr. Roy was qualified in the state eligible level eligibility test, Northeastern region, in the year 2015. He obtained Daniel Fahrenheit Fellowship, which is the Fahrenheit Union of Universities Poland, in the year 2020 to 2023 at international level and this national level. He has a membership in Learn academic bodies or organization. Dr. Roy served as an editorial board member in reputed journals, and he is also available as a reviewer of reputed journals. So this is small introductions about our today's guest speaker. So, sir, kindly proceed with the session.
Thank you, madam. I am very much thankful to Assam Don Bosco University, especially Department
Sir,
of
kindly unmute yourself.
Oh, thank you, thank you.
Yeah.
So actually, I'm very much thankful to Assam Downtown Don Bosco University, and especially Department of Pharmacy. I have few works related to human pharmacy related work or human health or public health especially. So Somraj is my colleague in Tripura University, and he just offered me to present one lecture uh, so that student can understand how that actually people think that geography means a river, mountain, and something like that. So even the application of GIS can nowadays is applied in the versatile department and transdisciplinary research application. And also I would like to share my screen, uh, just a minute. My screen is visible to you?
Yes, sir, it is visible.
Yeah. So today I will deliver lecture on application of GIS in public health. So I don't want to go into my introduction because already you mentioned about my introduction, and also I just focus on the particular topic application of geographical information system in public health, and how you can apply that in your research, in your thesis or master thesis. Everywhere you can use that this kind of knowledge. So without wasting time, I just delivering my lecture. Okay. So the application of GIS means GIS is a powerful tool for analyzing spatial data. Suppose you collect data from the field, suppose plant extract for your medicine. So and other thing also, you can just combine the mapping and the data management to visualize your data from where you get the data. Even in the disease mapping, GIS integrate the multiple data sources, enabling public health professional to identify the pattern and relationship. So basic overview of the GIS. First of all, when I start the lecture, I told that we have the misconception of the geography. So geography mean does not deal with the river, mountain, or hills, and not like that. Geographical information system is now work in the everywhere of science, because geographical information system is a science of where. If you work on the spatial data set, collect the sample from any physical world, so you can represent to GIS tool. So here we can do many things like the analysis the data, visualize the data, and interpret the spatial data. Okay. So in this lecture we will just discuss about basic concept of GIS, historical development and importance in the various field, especially in the human public health. So what is GIS? So GIS is a computer-based system that's allowed to capture, store, analysis, and display your spatial data. So there is a two kind of data set actually in GIS. So one is the spatial data set, whatever data you collect from the your field, like the school address, cultural agency, census data, those are the park, police station, bus stand, those are physically available in the real world. Those are the, you can see, you can visualize, that is the spatial data. And another data set is there, that is called the non-spatial data, which is also associated with that. So that is called the attribute data set, like the um, college program in the Don Bosco University might be there is a 38 course. So that is the non-partial data. But this is called the attribute data, the church population, student roster, those are the attribute data set. Okay. And then the partial data you can again classify into two categories, raster data and vector data. The vector data is actually line, point, polygon, those are called the vector data. And the raster data means the pixel. You can only just justify with the pixel, like the image. So those are the called the vector data and raster data. And the history actually, history of GIS start in 1960s, especially in start in Canada. Then it gradually technologically developed into different part of the world, developed in the software system in even after 2020s. So the developed of the web mapping. So many softwares company develop their packages, so develop the algorithm. Actually, in the behind the mapping, there is some mathematical algorithm. We are just functioning on that. Suppose someone very good in writing code, so they can also prepare map in the ArcGIS, because even every company nowadays provide the Python and R console to prepare the mapping and all. But how it is related with the your subject, like the pharmacy or public health management actually. So disease mapping, we can do the spatial distribution of any disease. So where is the hotspot zone, and the distribution of the disease, and the risk assessment, the environment and the social factor, how it's related with the disease risks and all. And the targeted intervention, use the spatial analysis to allocate the resource and implement the preventive measure. So it is also important. So disease mapping, what we can do with this is I just represent everything from our own research, actually what is experienced by me and my team. So one paper we published in Nature during 2021. So that is in the Purulia. Purulia is a endemic zone for the malaria case. So we found that few area of the Purulia is that's represented in the map in the red color. you know that is the most endemic. The vulnerability is there, but in the gradually periods of time, if you prepare the chronological map, so the vulnerability or risk factor is reduced with the passage of time. So since 2020, 2016 to 2020, we prepared the map, so we found that shows how it's changed, the pattern of the development, which zone is vulnerable, why those zones are vulnerable. So this you can do also in your research, and it gives you more value in your research, and subject of acceptance of research paper will be higher. Well, so then the environmental health, suppose the air quality, water resource management, we have published, Somraj also co-author of that particular paper. The water quality, so we find out that the basic parameter, the physical parameter, chemical parameter and biological parameter like the E. coli, coliform, physical parameter like the pH, TDS, turbidity, and chemical like the sodium, sulfate, potassium, the iron, and all. So you can calculate, you are very much expert on this. But the thing is that how you represent through your map,
Is that how
that
to
is important.
represent your
If you
land?
represent in this map, so
This is
your
important.
paper
If you
or your
attempt to
thesis, value
represent
of
in
your
this map,
thesis
so your
will
paper or your
give more
value
value,
is
because your
will
expert is
give
always
more
usually
value
check the
because
statistical
your
database
expert
and
is
all.
always
So
your
this is the new thing in your
statistical
subject,
database
you
and
can
all.
implement that.
So this is the
Even the
new thing
hazard
your subject
zonation,
or
uh, you know
even
like the local toxicity index, and the waste management side, chemical hazard and the environmental hazard zonation mapping, you can also prepare using the GIS tool. Okay, and then we publish the similar environmental hazard, and also which environmental factor are related with each other. So here also we, in the Purulia district, we published the paper in 2022. So we found that, so there is some geo-environmental factor like the relief, like temperature, like rainfall, that also influence the growth of the bedding of the mosquito. So which is the reason for the malaria case. So here in the hatch marking, so that is the endemic block and non-endemic block, you can see the difference between the rainfall and relative reliefs, and all are associated with our own research, because whatever I am saying, that is, we face the problem, we resolve the problem with the help of GIS, and we are successfully published this paper in the top journal in the Nature. So you can also do this thing, just need to learn how to prepare. This is not very tough thing, you can learn very easily. And then I will go into the healthcare access. Suppose you want to locate at the hospital, so different hospital, clinics and all. Suppose some of my student in University of Gdansk, Poland, they are working on the medical tourism in Turkey, because that is very popular for hair plantation. So how they distribute, and the which district or which area is more popular, what is the distributional pattern that propose the ITW, inverse weighted distance method. So what is the reason and the associated factor, it's called the catchment area. So your you know donation in the targeted area from where you provide the services, total population of that particular area, those are called the catchment area. You can also do that thing. And the site selection, suppose you want to propose the new hospital or new suppose some clinic, so where is the right place for propose that thing. Suppose um, Don Bosco University plan to set up another university in Northeast. So which state and which area will be the most suitable? Any city, which city? So based on the catchment area analysis, based on the healthcare facility, based on the available resource over there, resource gap over there. So we prepare that thing with the help of the maps. So we can identify the suitable area. And the population analysis, suppose the demographic data, suppose in Northeast, if you consider the Northeast India distribution of the population, so how they are distributed, their income, ethnicity, race, and how you connect with your disease data. So that is also very important, and that is also very important. So and the health implication that may provide the disease, and the which region, which disease is the more uh, uh, more what is it that the more uh, predominant actually. So even in the I just start working with Somraj regarding the vector-borne disease of Northeast India. So district-wise, when we collect the data, so we just try to understand that is there any geographical factor why those particular area is the prevalence for the disease actually, where is the mortality rate is high, why does mortality rate is high, what is the gap between the geographical phenomena, is there any policy gap, suppose even government take the policies, so policy might same for the all the state or all the districts, but where is the gap, so we try to find out and some propose some partial modeling that create more value in your research, whatever you write research paper or you just do for your master dissertation or your thesis, so it give you that extra value. And then the emergency management, that in emergency it's called the disaster we just plan as the three, like the pre-disaster response, during disaster management, and the post-disaster management. Suppose pre-disaster the response planning, so if we know the optimized route, so optimized route for the ambulance or the hospitals and all, so there is a pre-disaster during disaster model, so where is the hotspot, natural calamity, their buffer zone, so what is the core area and what is the we called it the epicenter of the disaster, and that the identify from the disaster area what is the resource has been destroyed and how you prove the thing. And third one is the post disaster evacuation planning and alternative solution management, everything you can represent through your map because any layman also can understand. Suppose one statistic might not understand by any layman, but any map they can understand, they can understand from the color. So yes, the red color is mean the danger zone and the green color mean the safe zone, so people can easily understand. It is better than the number, you can write the thing, because everything we prepare behind that there is a mathematical algorithm. You need not to know all the algorithm, because we are not from the computer science or who can write the code and all, so but you have the good speed in the writing code, you can write your own code and you can design your own map, because every software now give the console of R and Python. Even you can use the Jupyter notebook, pandas, and anything. So and the health communication risk map, suppose the visualize the risk level of this particular area, and effective the public communication, how it's related with each other, and the outreach planning, so identify the target area, so optimize health campaigning, suppose department of pharmacy, Don Bosco University, Assam. So they plan for the one health campaigning, but which area of Assam they will do? If you have the database, you can prepare the map. Yes, this area is vulnerable for this disease, and we will go over there and we can compare. Campaigning on that. So this is the outreach program planning. So you can do with your GIS mapping and the web mapping. I told you earlier that after 2000, so that web mapping server, suppose earlier people download the images, process this thing and all, so now you can prepare your map online, so no problem, just you have to access all those resource and you can prepare the map very easily and very short time, so it will be easier for you. Then the surveillance system, well, in surveillance system, we use the three method, the real-time monitoring, the integrated GIS disease surveillance is the early outbreak detector, then the mobile data collection, the find the team, where is your team, how they provide the service, how far from here. So you from the GPS live location, suppose for example I say from the Uber map, you can see that where is your car. Likewise, if you able where is your team member, where they are working, whether they are working or not, you can monitoring everything through the mobile data, well, the GPS, geographical positioning system, and global positioning system. That the spatiotemporal analysis in the first map we published in Nature. So there we present that from 2016 to 2020 how the disease mean cluster of the disease shift from the one place to another place. It is called the space and time. That's all. This is the spatio-temporal for the Assam. Maybe in the if you have the time series data, you can also show that where is the disease prone area and how it shift and whether there is any improvement or not. If not, so what will be the policy, policy recommendation for the government, what are the best practices. So you need to identify that thing and then you just solve the problem. This is the basic thing. And the healthcare utilization. So healthcare utilization, service area. So in which area you provide the service. The map, patient originated. Suppose every hospital now the collect the data of the location. So what they do with that data? So they just make one map. Suppose we work with the one, nursing home in Kolkata. So they just provide the data of the patient. Okay, not the name of the patient actually due to the some ethical thing. So they just provide some Excel file of the data. Just you not just need to locate their place, and so they can understand that where is their service zone, and they want to extend that more than 10 kilometers. So what kind of marketing strategy they need to take? So they are planning after getting the data from the map of service area, then they can increase their business. Even same thing, the authority of any university can do so based on the student mapping from which area they are coming from. Understand that thing. So if you can develop, suppose one consultation or campaigning in this particular area, you want to reach out from other area also, suppose in the northern part of Bengal, in North Bengal area. So what kind of strategy you need to take? So those kind of thing you can do with the help of GIS. It is called the accessibility measure, the time, distance for the healthcare you can do also, and the resource allocation, the optimization of the distribution, equipment, staff, funding, everything you can manage through your system. It is that MIS actually, it is integrated with GIS, the management information system, and GIS, geographical information system. You merge together, then your business potentiality will be higher. Then the vector-borne disease. So in vector-borne disease, that habitat, mapping, the identify the mosquito breeding. So in case of, this thing, Purulia, West Bengal, I already mentioned because we have the personal experience. We do research on that, and we visit the field many times. We can understand. We can, prepare the maverick zone. Even in the Dholai district of Tripura, we also work the same. And the transmission modeling, the predict the speed based on the climate, vegetation, socioeconomic condition. In the second paper we are also mention on that. So and the intervention planning, so what kind of strategy you need to do, the spaying, education campaigning, the control factor. If you plan for the education campaigning, so which area, where is the settlement located, this most settlement, suppose how you categorize that based on your budget. So you can prepare all those things through your GIS knowledge. And the food safety, so even in the biotechnology also we are using such kind of instrument like the GIS system, that agricultural monitoring, the map of farm, crops, livestock, everything inspection over the period of time. So monthly database and all, and the foodborne illness tracking. So we just try to understand and the which climatic condition and why such a foodborne illness happening. And the even the supply chain tracking also using the distribution network, using GPS, global positioning system. Nowadays, DGPS also performing very well for the more accuracy, and the track your mm, track your product and all. And the community health planning. So might be you are working on that. Suppose few university of India who are don't have the lab facility, they just want to work on the field because of the community health planning and all, health management. Some universities is very much interested to work on such things. Suppose we are associated with NSHM Durgapur, the healthcare management department, so they are also working such kind of thing. The need assessment, first of all we need to understand to where health service is required, Then we go for the resource mapping, that where is the cleaning, grocery store, park, hospital, bus stand, everything. Then we come from the program evaluation, evaluate the impact of the intervention policies and the specific neighborhood, and the stakeholder engagement, that PPP model, private public participation, or if you have some independent project, so you can implement over there, you can get the data, you can write the paper, and there is a social impact of the community impact also. Suppose somewhat you are not familiar with the laboratory testing. Even in the laboratory testing, you collect the sample from the field, so that you can also represent where is your sample station using the GIS technique. Well, so and the health disparities and the socioeconomic factors, social inequalities. This is a two main factor actually. Income map, education, housing. Actually, there is a model. It's called the Kapuswamy model in the socioeconomy. So we use that thing. There we consider the three things: the income, occupation, and education of the family. So how they are invest in their health, so how much percentage they invest in their health recovery or health disease and or medicine and all. So this thing, so even the partial inequalities, suppose in the geographical differences, in the even in the Assam, the Guwahati surrounding area, even you consider in the central part of Assam like the Tejpur area, and the northern part in like Dibrugarh area. So even you can find some differences in the disease differences or investment in the health. So even you can connect, you can correlate with the data with the your it's called uh, disease and income, investment in disease, and the number of disease occurred of this particular area. So you can find out the gap, and then you can go with the intervention. Ultimately, policy is required for development program. So how you reduce that thing? Suppose in pharmacy you produce the medicine, so which area, which medicine is required, what is your target market, whether it is Indian market or global market, which disease. So you need the database, then you can plan. So what is the locally available resource, you can extract the material from locally available resource or not. So you need to think on that, and then you can work on that. Even GIS will help you to find out the area, find out the sample station, find out the your implemented area where you implement that medicine for the test. So suppose that for clinical, so you need to take the consent and also ethical clearance and all, but you can study in the field, so take the consent and like this. So by this way you can do climate and health. Suppose some extreme event like the forecasting model, heat wave, flood. In Assam, it is very common a flood every year, almost every year. But there is some geopolitical issue with the China, so I will not like to discuss now, because I have only few minutes to discuss with you, so that I will not able to cover all the thing. And the air pollution, even the PM 2.5 or PM 5, PM 10 like this. So in the every city they have some monitoring system, respiratory effects. So you need to make a plan which zone is more polluted and why those zone is more polluted, using the keying, IDW. So those term is very uncommon for you, because this is very technical term. So but it is possible to do. I just give you the brief idea what you can do with the help of GIS, what is the area of application, got it. And then the disease pattern, so identify climate driven diseases, and in the vector habits and infection diseases. So you need to understand those factor, and for the better explanation. Okay, and the global pandemic. So we are familiar with the COVID-19. Even you can find the many paper published after COVID-19, that the outbreak monitoring, the travel pattern, the health service, capacity, especially ICU bed and the hospital, you can find over there. Even the government of Italy funded huge amount of money to do research on this, because they need to know in which hospital having how much capacity and what is the road connectivity, which road is the most fastest to your resident to hospital, the green zone. So those things they provide the fund for the research. So there is the many team actually in the higher education, there is no such kind of subject actually. You can work in pharmacy. I am working the cashier management, suppose geography, sociology, economy, and the other discipline, chemistry. So they can work together to solve a problem. Even in Europe, especially in the Poland where I am working over there. So there I have found the research is, such a transdisciplinary. There is no such subject. Yes, there is problem. You need to solve the problem, because my postdoctoral research is associated with, term logistic management. You might say that many econometrics model, many thing I have to incorporate over there. I am not from economics, so how I can do that thing? No, this is not the your answer will be that I am not from the, this subject, I cannot do this thing. This is your problem, you have to solve this problem, you have to learn. So until and unless you can learn the new thing, there is a no scope of your future earning also. So because nowadays, your AI, machine learning and deep learning occupy the entire market. After 5 years and 10 years, if you don't know such skills, so you will be, just a minute. Hello. Huh? Just a minute. uh, कहाँ से कैंसिल नहीं हो रहा था पहले से ही? देख अभी शेयर हो रहा है क्या नहीं हो रहा है? Skin is visible now. Now my skin is visible.
Yes, sir, it is visible.
Okay, okay. You can speak when, if it is not visible, so then you can speak.
Yes, yes, sir, it was just for a few seconds that it disappeared, but again it came back.
Okay, now it's visible, no?
Yes, sir, it is visible.
Well, so then the refugee health, even, we are, know that many geopolitical issue like the Syria problem, like, here in India, Bangladesh, Myanmar, there is a Rohingya issue. So that the refugee health is a problem, that because of the population movement, the map is a pattern of their displacement, camp condition, health service accessibility, that you can also represent through your map. Well, then the injury prevention. So I am also working with the physical education. So I know that how you need to work on the injury prevention, how the GPS data and the tracking, and also prepare the modeling of the workplace has. I mean, not only just globally, there is many things like the traffic accident, uh, workplace hazard, like the, we have one research paper on the auto drivers. So that is occupational hazard. They are, driving the auto in the different posture, so they are some problem in their shoulder, neck, and all. And you can understand in which area, the volume of the population, what's the reason, how much time they work on that. So that, and you solve with the orthopedics doctor, consult with them, what kind, even the yoga expert, so what kind of practice they will do to resolve the problem without medicine. And even if it is required, then you can do. Then the neighborhood safety mean the correlate the injury rate and the environmental condition, mean the street condition, lighting, and also each and everything is associated with each other. So you need to understand the problem beyond your subject, then only you will come out with a very good research paper or very good thesis or whatever, master dissertation, anything, any article to write, any page of your life. So, and the risk communication mean, hazard mapping of the population, vulnerability of the, environmental risks, and then, expose assessment model of the dispersion of the pollutant and the, potential source, public advisories and communicate the hazard to the interaction web map, so you can identify and you can know those areas is vulnerable or hazard zone. You cannot take this thing, and you cannot take the water from this region that might be arsenic, contaminated and all. So you can do through your map. And the radiation monitoring, yes, you can say that how GIS can help radiation monitoring. Yes, we can. The map located the power plant, the radiation material sites, the exposure pathway, the model of the risk air, water, food contamination. So we can do, I mean, the GIS can do. So if you learn that tech skill very well, so you can also do. And the population tracking, they identify the affected population for monitoring and treatment, so you can do that thing. And the first responder support, yes, through GIS you can do this thing. Identify the mapping, routing and the navigation, building data, the access the floor plan, utility line, hazmat info, so you can do everything. And the health workforce, the training program, we are also working with different nursing colleges or hospitals, so that we just train them that how you maintained or monitoring your workforce to GIS systems. So map location of the medical or nursing school, their pipeline supply and the job recruitment. Suppose in our consultancy also we follow this kind of model, identify the area of the workforce shortage. So technical, what kind of training is required for them, outreach optimization, so locate mobile clinics and the community health workforce. So you need to identify area where your support is required, so you can provide the service. And that Philip Kohler says that no lunch is free at the end of the day. So when you provide the service, that's mean definitely you can earn money on that, but you need to understand the area where you want to provide the service. More service mean more money you can earn. And then you come to the maternal and child health. So birth outcome monitoring, infant mortality rate, so but defects you can also record it. Every data you can produce, you can represent through your map. Prenatal health care, risk factor analysis, also environmental exposures and the social determinants. So I discuss about the income, occupation, and education. Those are the basic social determinant. So how that is influence the child health or maternal health. So you can also produce to map. So when you go for the project, you ask for the ministry of DBT or DST. So they just look that what is the your basic skill and what is your additional skill. Your basic skill is producing medicine, no doubt about that, you will do. But it is your additional skill. If you have this skill, so your potentiality to get the project will be more higher. And the health behavior mapping, so this is a psycho behavior mapping we actually say. So map available in the park, different recreation sites and also nutrition environment, identify the food disease lacking of the grocery store and farmer market. So you can also the health behavior mapping. And then you can propose the alternative thing. So when you launch some product, so you need to identify something new. So and then I will come to the some demonstration. uh, Somraj, how much time I will get for demonstration? Are you there, Somraj? I am audible.
Hello, sir. Yes, sir, you are audible. Sir, you can proceed till 12 o'clock also, no issue.
Okay, actually, this is all about the practical thing, no? So,
Yes, sir.
yes, so that only one lecture mean it is not possible to demonstrate all the things. So I just would like to, share my screen and just demonstrate so that they can, feel more interest to where is the, work area, how they can do this thing by their own. So they can find that there is a different maps in their research paper, so how they will produce those kind of map by their own. So I just would like to share my screen So you need the three things. Okay, presentation. Three software you required. Okay, for this presentation. So first of all, you need the QGIS, that is the free software you can easily download, and the Google Earth you can also use, and Global Mapper I will provide this software to you so you can also access. This is not free software actually. I have the license, so I will provide to you. So and here I just write the ArcGIS, and even you can use the QGIS also because QGIS is the free software. Okay, so what you need to do, just go to the here in the Google and search the QGIS. Well, so QGIS download, the free software is there. So download QGIS. Now 3.36.2 version is available. So you just need to download this software. Well, so I have software. I just open the software first. Okay, fine. Just QGIS, right? The QGIS. I have 23. Now is 36 version is available. So sometime it will take time to restore your plugins because I have more than 700 plugins, so it is take some time to load. Well, so you can just even in the QGIS and Google Earth also. Suppose you all are using this Google Earth, you can also download that Google Earth for the web version, so you can plot your map. So where is your sample location? Suppose you don't have the GPS because handheld GPS receiver, because your university does not have the geography department, so there is not requisition for the GPS and also from here you can find your study area. Suppose in Assam, in Guwahati, it is your university. So in nearby, suppose you collect the data from here in this region, so you just prepare the video photos. Yeah, suppose you collect the data from this region, this forest area. So, so you can just come here. Suppose your sample station, suppose this is your sample station, zoom in. So this from this road you want enter the villages, Assam, downtown university is here, Don Bosco University is upper side. So in this area, suppose from this area you collect the data. Okay, so you can plot like this the sample station 1 is 1, like is 1. Suppose your sample station 2, suppose in the any water body, you can choose any water body. Suppose this water body. Suppose for this for water continuation, you can choose. Suppose it's the sample 2 is 2. Suppose in the other water body, you just find out from here. Suppose where you collect the water sample. Suppose here the sample 3 is 3. Okay, is 3. Likewise you can plot your sample station. So even you can plot in your map. How? I just demonstrate you. Okay, and well, and you can took another 2 because only 3 you got. Suppose this one. So is 4, sample station 4, maybe sample station is 5. So is 6. Suppose stain. Okay, those are the sample station from where you collect the water sample for analysis the or different disease. You just collect the your sample, whatever the sample is, or medicinal plant, anything you can collect from here. Okay, got it. Now what you need to do, you just need to not just single by one, you need to go to save place as. Okay, just save place as. Okay, I just go to the folder. Okay, just make a folder. What a beauty. Okay, so S1 save as place. S2, S3, S4, S5. Suppose S10. Okay, your sample set data you can get from your this way. I mean from the field using the Google Earth. Okay, then you go to here in the QGIS, just you click it here in the new map folder, create the layer, and you just put it here in the add vector layer, and then you need to go to here in the your data set. Suppose it is in this control A, then put it. Okay, you can see located. Now how you will that whether it is right or not, how you will understand that thing. You can add, just go to layer, add layer, and go to you know XYZ layer, add it. So you can understand your layer, you should be put it here, and then you can change the layout. You can change your default layout point, mean style, symbology. Go to here and put the different symbology layer, default. Yeah, you can put the black dot, also red dot. There is a n number of thing, you can put the red dot. Okay, fine. So apply. Okay, so you can understand. So just check. So you can understand from the right which area you get the data and all. So this way you can prepare the map. Is it tough or it is easy? It is very easy thing. You can do, anybody can do this thing. Okay, but almost my time is running out. Actually I have many plan to share with you. Actually we can prepare all those things. Suppose even you can put the data, just go to the attribute table, you can data add the data like the even the different nature of the disease and all. So you can edit the table and you can put the value on that, so you can add column right from here. So you can add, select this, select. So you can also do many things. You can put for one, so there is a maybe your value of your sample. Suppose you after the plant sun give some process to some synthesize process and all, come out some result, and that result you can also represent through this. And if you cut this map to your geographical location, suppose you are working only for Assam and also you can produce such kind of thing. Well, So then I will come to that why this skill is so necessary. Because of that, your expertise, your thing, the passive knowledge, invaluable skill set developed the address the human safety, efficiency, and all. So you can produce many things, and the strategic decision making, data driven solution, data interpretation, identify the pattern, evidence based policy you can do, and the career opportunity must say. Because you most of the student are the UG student, undergraduate student, so how you can use this knowledge in your career. So competitive age in the diverse careers, because you have knowledge of the pharmacy, but if you have the certain skill of the GIS also, so you can also earn money on that. So community engagement and all, so identify those pattern, plan, disaster, and from where you get the job. First of all, this question might asked by you. So your networking, continuous learning, expert guidance, so everything, I mean, we can provide you, I mean. And then just global relevance your skill. So just you visit here, I just share another side. If you have the very good skill on that, so what, from where you can get the money. So upwards, one the freelancing platform is there, so from here you can get the job. So I just continue with my Google account, and I just demonstrate you the why this skill is necessary. As a teacher, if I am not, only give you the education, that education is no value. So this is my failure. As a teacher, I am not giving the right thing. So until and unless you can earn money, and until unless you can develop your career on that, find job, you just go to here, find job, find job. Here and you search, here you can search. Yeah, just maybe load it. So recent job literature review. If you're very good in literature review, mapping, publication, research paper, everything. So write one research paper, only review part. So they will provide you $100, and that is very good skill set actually. So suppose you write the mapping, GIS mapping, okay, GIS mapping. Put hit enter. So you can find, even you can find that public health. Well, that is entire dissertation on the public health. You need the GIS data. It's provide you the $400 if you have the skill set, so you can earn this thing. So this is, it is possible. Because if you if I will say you the financial overview and the budgeting and all the this, not like this billing and earning. Yeah. So yes, I can earn money from this because of this. And you can work on that, you can also get money, you can also earn money, because you need to solve the problem. Because your skill set will solve the is if able to solve the problem. So there is a huge market, huge market in the map making and all. So you just find your job from here based on your skill set. So you find here n number of job. You can design your profile. Because my profile, I set the profile. Even I can guide you to how to design your profile, how to apply for the projects and all. So here you can, as a consultant, I usually charge over there. So even the project, even about my total income is more than 1K, so from the consultancy only. So only lecture module, then there is a, they pay me the $700. So there is a huge skill set. So if you have the skill set, you can earn the money. So if you ready to develop your skill set, so yes, I can help you out in this regards. So even our organization actually provide you some course. So if you join, if you wish, you can join. Maybe if you are really interested to learn map and how to do so. So I'm not here to promoting and advertising the thing, but I just want to give you beyond this. Because only 1 hour lecture is not enough to give you everything. There is a 30 hours actually course program. So if you join, those course will start by 20th of this month. One batch is started. If you not get any benefit, so no money we will take, we will return back. We will help you to provide the profile in upwards, and help you, I mean, recommend you to get the job and all. So if you want to register, I will share this presentation with you all, so you can get the information over here and you can register by this week. So then we will start the process in 20 by 20th of this month. 20th mean it is Monday, from next Monday. So by this Friday, if you wish, you can join with us. And for today's lecture, I think I am late, just this much. And if you have any question, queries, so you can ask me. I will be happy to help you out. I'm happy to respond you.
Thank you so much, sir, for this wonderful sessions. And I would request the students to kindly put your queries either in the chat box, or if you are unmute, you can ask a question directly to sir.
Sir, I think this topic is quite new for our students, and I think they need more sessions to get through the actual concept of this thing. And I think this is the first lectures they are attending, such first lectures, and hope we'll be having more things so that they can get clarify the actual concept of the thing.
Exactly. Because this is the very vast thing also. But nowadays, if you look any research paper, and also they publish the GIS map. So even the Somraj is your colleague is working with you, and he has many paper in nature, also two paper in nature working with me, and another paper in other journal, in Arabian Journal of Geoscience, that is the water resource. So there we use the GIS tool. Actually, in nowadays there is no subject beyond one point. So if you want to train your students such a manner so that they can learn and they can earn, so such kind of skill is very much required. Even every of my student in University of Jidangs, they are usually based on their skill. Suppose someone is food planner, someone is facial manager, working in the urban planning, and also they are working with the different tools using the AI and machine learning. Even we can design the different things. Suppose how we can do the literature review, because your student, my master student or graduation student, they don't have much time to write paper and all, because there is lots of papers to complete, assignment and all. But at the end of the session, they need to publish the papers, few papers, because it is also required for the NAC and all. Even same thing in applied for the faculty members also, because you are also very busy to take the classes and all, maybe 3 4 classes in a day. So it is very difficult. After that you concentrate on the research and all. So but how you can do that thing? Based on the collaboration, develop the new skill. Because if we don't know the new skill, especially the AI, machine learning and all, so it is difficult for us to sustain in this market, because this academics is very much dynamic. It is changing every single day. So if we not prepare ourselves for that particular environment, we will not able to sustain next 5 to 10 years. I mean, because all those institute are corporate institute, they just keep growing with the passage of time. So they want to bridge between the industries rapidly change, because AI almost replace to many workers. So you need to develop new skill. Only your skill can help you to sustain over here your paper and also, even as academician also. But in the environment, I do understand, because I also when I come back from Poland, I just try to understand the Indian market. That's why I joined Amity University Kolkata. But I found that there is a no growth and potentiality. So that's why I just developed the not KND, actually, Knowledge and Business Think Tank Academy. I just want to train the student, train the faculty member, mean through the FDC, through the orientation program and all. So which by this way they can sustain their life, because corporate might throw it out because they need only services. I honestly speaking, in front of the camera might it's recording, your authority might be here, but this is the fact. I just must understand that fact. So you just train your students such a manner so they can sustain in the market, so that your university can grow up in near future. So this is the thing what I want to say.
Very true, sir. In this era, it's very much required. Obviously, in coming time, they will be requiring everything, combine things.
Yes,
So
yes.
accordingly, we need to upgrade our teaching system too. Gradually, we have to upgrade. Thank you very much, sir. This from my end.
Thank you, thank you.
Students, is there any questions?
Any question, queries, anything?
Because sir, is there any questions from the student side?
Because Devnath.
Yeah, I saw he's standing there along with students.
Okay, okay. I know him very well. He is also there in Tripura University.
Okay, sir.
Okay, anyway, so you can arrange the next session. So I can actually want to give another thing for your student. That is how just recently we discussed with my colleagues and all. So how AI can help your student to design the literature review and all, because they don't have much time to do all those things. But if they know the skill how AI can do that thing, so that is easier for them. And I will give you 1 hour lecture on that. So based on the availability of your classes and all, and my availability, just I will discuss with Somraj and inform you that when it will be better. So then I will organize another meeting with your student. So such kind of training is very much required for the student.
Yes, sir, sure. We'll be happy to do that. And okay, if there is any questions from the students, I would like to request Dr. David, sir, to kindly give a summary of the event.
Very good afternoon, Honorable today's chief guest, sir, Dr. Prabhak Roy, and our respected principal, sir, and our dear teachers and my students. So today we understood the very true meaning and the understanding of geographical information system in public health. And sir have already included the very key aspect of the geographical information system. In that first one is that spatial distribution and then risk assessment and the targeted interventions, which is comes under disease mapping. And in spatial distribution, we understood the epidemiological distribution of the patient, where we can find easily with the help of geographical information system and analysis. And in second one, that we try to understand about the risk assessment, where we try to find out and we can easily understand the factors which affecting the disease at different ages. And then third one is the targeted interventions, where we can easily find out the right intervention to manage the diseases. And then fourth, we try to understand about the emergency management, which consists of three another components: response planning, disaster model, and the evacuations. And again, we tried to understood about, and we understood health communications, where we can easily make a bridge between the healthcare system and patient. And sir also have included some career opportunities for the students in geographical information system. Along with, sir have also highlighted few papers which are already use the geographical information system mostly in parasitic diseases, and which were published in very reputed journal, and which are nothing but the epidemiological pattern and analysis of parasite population in West Bengal. And one more, the most prominent paper that we understood here, geo-environmental factors and the effectiveness of mulberry leaf extract in managing malaria. And we understood that as we are learning the extraction process also, and we also trying to, we can also make connections with the geo information system with our courses. And last, I have also demonstrated about the databases such as Google Earth, global mapper and Ask GIS. So where we can easily understand and trace the any kind of disease or the rationale of drug that we can correlate. So this is how we have understood, and there are many points to go, and sir have explained a lot. And so it is very exciting session that we understood all of our students and we all the teachers, and we are looking forward to collaborate you and hear from you, sir.
Thank you. Thank you very
Thank you,
much.
sir.